Here is the mandible, picture of the mandible. Here few important bony landmarks we must know. Number one is the most important mylohyoid line. It gives attachment to mylohyoid muscle, and here you can see a fossa called submandibular fossa. In that submandibular fossa only you have your submandibular salivary gland. So here is your submandibular salivary gland is situated, and it is covered by the deep cervical fascia. So the deep cervical fascia, when it comes over here, it splits into two portions. One is the inferior aspect that is attached to the base of the mandible. Another one covers and goes up, and it is attached to the mylohyoid line. So this is about the covering, and you all know this area is for the attachment of mylohyoid muscle. So this is the area for the mylohyoid muscle. So this gland has two portions. One is the superficial portion, another one is the deep portion. So the superficial portion is here. The entire thing is the superficial part. Another one is the deep part, which is inside, okay, which is the deep part. So we are going to see the relations of these two parts in the next slide. Here, the relations I have drawn. This is the inner aspect of the mandible. As we already saw the mylohyoid line, so you all knew this muscle is known as the mylohyoid muscle, and the posterior part of the mylohyoid muscle divides the gland. The gland, the superficial portion and the deep portion, they just are divided by the posterior part of the mylohyoid line. Okay, so the mylohyoid muscle divides it into two portions, and this superficial part relations you should know. It is related to the digastric triangle. It has this surface. This is called inferior surface, and this area is called the lateral surface, and this area is called the medial surface. The inferior surface is related to, so here you have the skin. So skin of the mandible, skin of the neck, everything will be here. So the inferior surface is related to the skin, as usual platysma. And if you tell platysma, the next thing is the supply, the cervical branch of facial nerve and fascia. Facial vein also, it's a very important relationship in the with the inferior surface, and a few submandibular lymph nodes. So the important things what you should remember is skin, super skin, platysma, and the facial vein. Okay, then the lateral surface where you see the submandibular fossa. This is the area called submandibular fossa. Here you can see the submandibular fossa very well. And this is the area, the rough surface gives attachment to the medial pterygoid muscle, and the facial artery comes and grooves here and then goes up. So the facial vein plays an important role here. So facial vein should be drawn with the inferior surface, and facial artery should be drawn with the lateral surface. It makes a groove in the lateral surface and grow up. Okay, so this is very important. These relationships are very important. And the medial surface now. The medial surface, the first one is the mylohyoid muscle. If you talk about the mylohyoid muscle, then immediately you should talk about the mylohyoid nerves and blood vessels and submental branch of facial artery. Then go back, you have the hyoglossus muscle. Further, if you go back, you have your styloid process here. So styloid process and related structures, styloglossus, all the muscle stylohyoid, and ninth cranial nerve. All this stuff you can write. Okay, so these are the important relationship for the superficial part. So again, I repeat, the superficial part, inferior surface is related to skin, platysma, and facial vein. And this is the lateral surface, which is related to the submandibular fossa, and facial artery plays an important relationship here, along with the medial pterygoid muscle, which is attached to the angle. So can you see the rough surface? Then the medial side. Medial side, you have to divide it into three portions. Number one is the mylohyoid. Number two is the hyoglossus. Still go back, you have your styloid. Styloid attached muscles are styloglossus and stylohyoid. That's all about the superficial relations. And the deep part is smaller in size, and you can see this, it lies above the mylohyoid muscle. You can see very well it lies on the hyoglossus muscle. So it lies between the mylohyoid and hyoglossus, number one. So the relations, how do you write? Laterally you have, this one is lateral comparatively, isn't it? Hyoglossus is along the midline. So laterally you have mylohyoid, very good. Medially you have hyoglossus, and above you have the lingual nerve, and below you have the hypoglossal nerve. So these are the four important structures you are supposed to write. So lingual nerve, can you see this? Along with submandibular ganglia, and this very important things you should remember on the hyoglossus muscle. What are the structures? Number one is the lingual nerve along with submandibular ganglion. Number two is the teeth part of the gland along with the duct. So MCQ is the duct of the submandibular salivary gland arises from the superficial portion or a deep portion. So you should write it arises from the deep portion and it hooks. Can you see there is the nerve and the duct, it hooks around this. So this relationship is very important. Which nerve hooks around? Lingual nerve. Understood. This is a very important MCQ. And third one, below the gland, you have a nerve called hypoglossal nerve. So these three important structures to be mentioned. So you should know medially which muscle, above which nerve, and below which nerve. That's all about the relations. Write the blood supply. You can write facial artery, importantly, and veins, common facial vein, and lymph nodes, submandibular lymph nodes. And the very important thing, submandibular duct, where does it open? It runs from the deep part of the gland and from the anterior border of the, can you see this anterior border of the hyoglossus? It is crossed by the lingual nerve and it runs to the floor of the mouth to the sublingual papilla, both the sides of the frenulum of tongue. Both the sides of the frenulum you should mention, and the submandibular ganglion, sometimes they may be asking as a subpart, and if you mention it arises from the superior salivary nucleus. So we'll see it in the next part. Here is the parasympathetic pathway of the submandibular ganglia, and here is the salivary gland. Okay, number one, superior salivary nucleus starts from the brain, from the superior salivary nucleus through the nervous intermediate branch of facial nerve. It comes out, and from the branch cauda tympani, it emerges out and it joins with the lingual nerve. So these are all the branch. The cauda tympani is a branch of facial nerve. So first you should start from the brain. From brain, it has to take a cranial nerve root. So that is the component of facial nerve, nervus intermedius. And from there, a branch of facial nerve, cauda tympani. Cauda tympani joins with the lingual. The lingual goes and gets relayed in the submandibular ganglion. From the ganglion, postganglion fibers goes and supply the submandibular salivary gland. That's all about the submandibular salivary gland.